Welcome back to Inside Guelph. Well, a beautiful smile can change lives, and no other person would know it than Dr. Gelfand here, who works with people and beautiful smiles every day. Thank you for being here.
Thank you for having me.
I was wondering, though, being a dentist, if when you're talking to people at a cocktail party and you say, I'm a dentist, do they suddenly go, oh, and cover up?
Absolutely. It's either that or they ask me, oh, so what can you do about that?
Is this normal? Yeah. Start opening up. But it is important, the beautiful smile.
Absolutely. Everybody wants to have a beautiful smile, everybody wants to look good, and everybody wants to look younger. And this is a great time to practice dentistry. Oh, yeah? Absolutely. Any dentist that is taking advantage of the technologies that are available to us today can make a huge difference in people's lives, how they feel about themselves, their everyday life, how they life at work, and
nice. And the beautiful smile. Okay, so you just hit the word. You had me at looking younger. I was like, what? Yes? So cosmetic surgery, what do we need to look for? What are we considering? What is cosmetic surgery, first of all?
Well, cosmetic surgery consists of a variety of things. It's not always a surgery. It can be an actual procedure such as whitening, simple whitening of the teeth, and there's different levels of whitening, including the zoom whitening, which is extremely effective, and we have them in our offices. And it extends all the way to veneers, porcelain veneers, and implants, and reconstruction of all the teeth and in the mouth in a way that will make a person appear younger. With veneers, there's different types of veneers. Most people perceive veneers as just porcelain that goes over the teeth. There's really three types of veneers. Veneers where some teeth have to be shaved off. These are conventional veneers. And it's usually still okay. It's a nice result. It's a very, very minimal tooth structure that has to be removed. There's also the types of veneers where no tooth has to be touched, and we can still bond porcelain on the teeth. Those are called lumineers. Okay. And another type of veneers that I think very few people know of is called snap-on veneers. It's pretty popular in the U.S.
Yeah, that sounds great.
In fact, I think somebody from The Bachelor had them on.
Oh, the fangs?
Yes, those was snap-on veneers.
Brilliant. So you can take them on and off. So these are the things you need to consider. You need to know your options. And what are we looking for in terms of a cosmetic dentist? What should we be knowing that we're in good hands?
That's a great question. When you're going to a dentist, a lot of dentists say that they're cosmetic dentists. What's really important is to find out what they've done to become a cosmetic dentist or an aesthetic dentist, the education, the experience, to look for testimonials, to see before and after pictures of teeth and smiles that they've created over the years, and really to ask a lot of questions about what they're going to do to make sure that the teeth are going to look good, the smile's going to look great, how they're going to create it, and make sure that it lasts for as long as possible.
Would you suggest also maybe not being shy about getting a second opinion to make sure you're on the right track? Absolutely.
People come to us for second opinions all the time. Sometimes they ask me personally to do the dentistry for them, and very often they ask me what they think about what I think about their existing dentist, and I give them advice on what to look for if they want to consider their current dentist. Very often people have the regular dentist for the routine checkups and cleanings and fillings, and they come to this more specialty places
to do the cosmetic. Okay, now speaking of younger, what happens to our teeth as they age, or as we age?
Yeah. I'm glad you asked. As people age, most people's teeth become shorter. Most people grind through the teeth to a certain extent. Some grind a lot, some grind a little bit, but as the teeth become shorter, the distance between the nose and the chin actually decreases. And that is the one thing that gives people the appearance of looking older. As if you take a picture of anybody who at 20-year intervals, you'll notice that the face, the head, appears shorter.
It shrinks.
It shrinks. So there's a way to prevent it, and there's a way to improve it.
Okay. See, up until now, I was just worried about my brain shrinking. So now I've got to be thinking about my teeth and my face. But that makes you look younger if you can maintain your teeth.
It makes a big difference.
I didn't know this. Now, all of this work, when you say things like reconstructing all the teeth in your mouth and putting veneers on, Can we do this asleep? Do we have options?
Absolutely.
Because a lot of people are terrified of the dentist.
Yes, most people don't like coming to the
No.
dentist. In fact, lately more and more people come in and they ask if they can do everything done in one appointment. They don't want to come visit us many appointments.
Oh, don't take it personally.
I don't. There's nothing pleasant about coming to the dentist, getting needles. So we put people to sleep. We get everything or almost everything done in one appointment. When they're fully asleep, they wake up and dentistry is complete.
So I'm assuming same research, if you're looking at sedation, making sure that you're with a dentist who's been trained in anesthesiology or something, that they know what they're doing.
Exactly. There's different levels of sedation. They can be a little bit asleep, a lot of sleep. They can be fully asleep, just like in a hospital. And all this can be done in the dental office with the proper training and the proper support team.
So ask the questions. Don't be shy. You're not insulting anyone. If you say, how many times have you done this? What's your education? That's all good. Ask all those questions.
It's very important. It's your health, it's your smile, it's your beauty. You need to ask.
Brilliant. Thank you for being here. Good education.
Thank you for having me.
Old teeth. Good to see you.